All right. And today we have with us Amy Williams and Pat Burns from Express Scripts, who is the company that handles and administers our pharmaceutical benefit. So go ahead and take it away, Amy and Pat.
All right. Hey, Clark. Thank you. Thank you for the intro, and thank you all for allowing us to participate today. My name is Pat Burns. I am the Senior Account Executive with Express Scripts. Been with the company for about 24 years. You guys may have known Sue Wolf, who I took her place. She actually retired. So she's allowed me to step in and service you guys. So today, it really is going to be an Amy Williams show. She's our senior account manager. She's going to be the one that's actually going to go over your farm benefit. And so, like Clark said, at the end of the presentation, we do have enough time allotted for you guys to have, if you have any questions, then to make sure that you do so at that time. As I said, I'm not going to take Amy's thunder, so I'm going to send it over to her to actually go through the presentation. So with that, Amy, here you go.
Thank you, Pat. Clark, if you want to go ahead and start getting the presentation loaded, I will introduce myself. So hello, everyone. Good afternoon to you. For those of you that I have not spoken to since I've been with the state of Vermont and servicing them, you will be able to tell from me talking today that I live in Minnesota. So I am not in Canada. That's the thing I always get when I travel around and speak to all the members. I have a strong accent. I don't know why. So good afternoon to you. I've been with Express Scripts for just over 8 years and servicing the state of Vermont with your pharmacy benefit since that time. So I really enjoy working with you all, and we're going to take today here, you can go to the next slide there, Clark. We're going to take today to just go through just a high-level agenda here for you. We're going to talk through the pharmacy benefit that you have through the state of Vermont, just high level. We're going to go through some common definitions that we hear about on a regular basis from members, just can be confusing as to what they mean. And then we're going to talk about some resources that are available to you just so you can just maximize your benefit that you have. So go ahead to the next slide there. Perfect. Okay, so as Clark shared, and as well you all well may be aware, so your pharmacy benefit is managed through Express Scripts. So we are a pharmacy benefit manager, or you may hear the acronym PBM. You have access through your benefit, you have access to over 60,000 pharmacies located across the United States. You have the option of those pharmacies where you're able to get up to a 90-day supply of those long-term medications, as well as an option through Express Scripts Home Delivery Pharmacy to get those long-term medications. You also have access to pharmacists through your member services team by calling your customer service number 24/7 to help with any questions that you may have. And then you also can manage your prescriptions anytime, anywhere. We have digital tools available to you. We'll touch on the mobile app and expressscripts.com. So next slide. Okay. So when you visit a retail pharmacy, what you'll do is you want to present your prescription ID card. So that is going to be different than your medical ID card. It's similar to the one that's shown here on the screen, which is a pre-Medicare ID card sample. But again, similar in the look and the feel of what you see when you are reviewing your ID card. So on the front, of course, is information that your local pharmacy needs to process your claim through the benefit. But then on the back is where you have the member services telephone number to reach out to, and that is your primary source of information. So going through them, you're able to get in touch with any specialist or possibly a nurse, anybody else in our team that can help answer your questions and your needs. So that is going to be your number that you call. Also on the back of that card will also be other helpful numbers that possibly the local pharmacy may need to use to help navigate if they run into any sort of technical issues or edits when processing your claim. So it's good to have this with you. Keep in mind for those that have already downloaded our mobile app, or to incentivize you to download our mobile app, is to get a electronic ID card, which is always great to take one less thing out of your wallet. So that's another thing that I wanted to make mention of. Next slide. Vaccinations, really the topic of conversation, really the last couple of years at the top of our agenda, right? So really to help you stay healthy, we do encourage you to receive those vaccinations, including the COVID-19 vaccine, and of course this time of year, the flu vaccine. It is covered underneath your prescription plan at a participating retail pharmacy. So that is all preventive vaccinations, as well as underneath the Medicare Part D plan, those prescriptions that are Medicare Part D. So what you want to do is to call your local pharmacy first, ask the pharmacist which vaccine is right for you, and then you can also make sure that they have stock of that vaccine before you go and visit that pharmacy. And of course, when you visit that pharmacy to get your vaccination, you present that pharmacy ID card again. And those, also I make mention, but it'll be on another slide as well. Vaccines underneath the Affordable Care Act, and then also through the Medicare Part D plan, is zero cost to members as a preventive item. Next slide. A credo. A credo is a specialty pharmacy. It's an option available to state of Vermont members for filling those specialty medications. So specialty pharmacies, they provide personalized patient care for members with chronic and complex health conditions. So credo members receive ongoing support from specialty trained pharmacists and nurses, along with individualized counseling and education. A credo also offers proactive patient monitoring through regular assessments and touch points with the patient, as well as care coordination with the entire healthcare team. So including the physician outreaches, any disease management or case management. The specialty pharmacy helps tie that all together to keep an open line of communication to better the health of the patient. Credo also, I want to make mention, works with manufactured patient assistance programs that may be available to help reduce those copays as well and improve adherence. So I want to make mention of a Credo, which is a partner pharmacy of Express Scripts, as an option to you to fill those specialty medications if you're prescribed one. Next slide. Thank you. Long-term medications, I mentioned those earlier as well. So long-term medications or maintenance medications, they're taken over a sustained period of time. So like high blood pressure or cholesterol medications are good examples. You can receive a 3-month supply of these long-term medications instead of a 1-month supply. So a lot of benefits to that. One of them, of course, is convenience. So you are able to locate a participating retail pharmacy that can fill up to that 3-month supply, or you can look at transferring your medication to Express Scripts home delivery and have that shipped right to you. Through the state's plan, you have a co-insurance benefit, which I'll show on another slide here. So you may definitely see a savings when you move over to a 3-month supply versus filling these type of medications monthly. And to locate, I also make mention, to locate a participating pharmacy that can fill up to a 3-month supply, you can go ahead and log on to expressscripts.com, or you can go onto your mobile app, and through the pharmacy locator, just by typing in your zip code, you'll get a list of pharmacies that are close to you, and it'll clearly indicate if that pharmacy can fill up to a 3-month supply or not. So you'll be able to know which pharmacy you're able to visit. If you choose to get started with home delivery, it's very easy to do so. Multiple ways you can do that. You can call into your customer service telephone number and just voice to them which prescriptions you want to move to home delivery. We can reach out to your doctor for you to get that 3-month prescription in-house and get it processing for you. Another option is to go on to expressscripts.com or onto the mobile app. You'll be able to see there the list of your medications you fill at the retail pharmacy, and you can, with a click of the button, go ahead and add it to your cart to move it over to home delivery. That way as well, we get a notification that you want to get started with home delivery, and we'll reach out to your doctor for you. So there's 2 ways right there to do it. Another way is if you're talking to your doctor, very easily you can tell your doctor that you want to fill your medication through home delivery, and they can easily send us a prescription electronically and get it started. So different ways to go about getting that started for you. Through home delivery, you're able to enroll in automatic refills. So when you get down to that last refill on your prescription, we automatically reach out to your doctor for a new prescription, so we don't have any sort of gap in care there. And let's see here, you can also then of course, manage your prescription with our digital tools and payments and so on. So it's very easy to do that. Again, added convenience, which is really nice sometimes. Next slide. All right, this is what I made mention here, just to kind of touch on your prescription plan at a glance. So the state has done a great job at really trying to mirror as closely as possible the benefit between the pre-Medicare plan and the Medicare Part D plan. So this, again, is very high level. And so looking here then first at just the copay structure, it's broken down into generic medications, preferred brand medications, and non-preferred brand medications. No matter what channel you fill your medication through, this is the coinsurance benefit breakdown. Of course, generics being the lowest cost at 10%, then going to preferred brand 20%, and then non-preferred brand at 40%. The state has various copay exceptions, so different copays set up for different classes or categories of drugs. For example, under the Affordable Care Act, I know that they have added that over to the Medicare Part D benefit as well. So those preventive medications are at $0 cost to the member, including those vaccinations that I talked about. So if you have a question about a certain medication you're prescribed and it falls under the preventive medication, go ahead and talk to your customer service team. They'd be happy to confirm that for you. Another copay exception I want to make mention that is definitely worth mentioning is select diabetes products. So we have select diabetes products where we have worked with the manufacturer to get the copay down. So there are select products that are set at a maximum of $25 out of pocket per 30-day supply. And so if you're filling these, which are long-term medications through a 90-day supply, you're looking at a max copay of $75 per that 90-day supply. So that's a really good benefit, and that is one that was passed on and added to the Medicare Part D benefit quite recently, and so that is in place on both programs. The other thing to make mention of here is biosimilar medications. Those are set at a 10% coinsurance after you've met your plan deductible. So biosimilars, very high level here, they are near identical alternatives to FDA-approved biologics. They have similar safety and effectiveness of those biologics. So now what are biologics? Biologics are very costly medications. They're derived from components of living organisms such as blood, cell tissues, or proteins. And these types of medications are crucial in the treatment of complex and rare genetic disorders. And so these medications, again, can be very costly. And biosimilars coming to the market for these medications, again, with similar safety and effectiveness, help drive down the cost. And so in support of that, then, through the state's benefit, you will see a 10% coinsurance if you are prescribed one of these medications. The last thing to touch on here I want to talk through is the accumulator setup. So that is a deductible or an out-of-pocket maximum. So under your benefit, you have a deductible. So this is a dollar amount that needs to be satisfied first prior to going into your coinsurance part of your benefit. And so that is $50 per individual, or if you're on the pre-Medicare plan, you're looking at $150 per family. And so you will first satisfy that amount in your deductible. Then you're going to go on into your coinsurance benefit, which I just talked to, that breaks down those tiers: generic, preferred brand, and non-preferred brand. And then you have different buckets. This is the one I spent some time on, and I can certainly answer questions later as well. It's kind of get confusing, I understand, is there's two buckets here. So an out-of-pocket maximum is the max that you will pay out of pocket for medications for the benefit year. There's a $750 per individual out-of-pocket maximum, where it's only generic and preferred brand products, including all specialty products. It does not matter what tier those fall on. Those medications apply towards that $750 out-of-pocket maximum. Non-preferred brand products. Claims that process for non-preferred brand products only apply to the higher $1,350 per individual out-of-pocket maximum. So I'm going to just quickly, a high level, go over all this again, okay? So we have deductible, $50 per individual to satisfy first. Then you're going into your coinsurance part of your benefit. those dollar amounts are applying towards your out-of-pocket maximum. All specialty products plus any generic and preferred brand go towards that lower out-of-pocket max of $750. Then any non-preferred brand products go towards the higher $1,350. Now, one thing I will make mention is that any dollar amount that goes towards that lower out-of-pocket will cross-apply to that higher out-of-pocket max of $1,350. I just wanted to make clear that it's only non-preferred brand products that will go towards that higher bucket. So I know it can be a mouthful. I tried to make it clear there, but we can answer questions as they come in later as well. Next question, or next slide. Thank you. All right, now we're going to transition here into just some common definitions that you may come across in the pharmacy benefits. So next slide. A drug list. So a drug list can interchangeably be considered a formulary. So it's a list of drugs covered underneath your prescription plan. These drugs are routinely reviewed by an independent panel of physicians and pharmacists. So it's broken down into those tiers that I just talked through with your co-insurance part of your benefits. So generic, preferred brand, and non-preferred brand. And so one thing to just make mention here is if you're ever prescribed a drug that's not on your formulary, so it's coming up as not covered, I just wanted to make mention that you do have the ability to request a clinical review. And so it's only your doctor that can give us the information that we need, chart notes and so on, to help us to complete that review. And so they can do so to request an exception for you to be able to get that medication that may be initially not covered under the formulary. And so it's always good to talk to your doctor. If you come across a medication that you find is not covered underneath your benefit, first talking to your doctor about if there's a generic out there or an alternative brand that can work for your therapy. That's the first thing to talk through. And if there's not, then it's going down this road here of just having a clinical review completed. Next slide. All right, more about generics here. So when appropriate, we definitely encourage you to consider taking advantage of generic prescriptions. FDA-approved generic medications contain the same active ingredient as brand name counterparts, and they're just as effective. So in fact, 9 out of 10 prescriptions filled in the US are for generic medications. So, and it typically costs much less to you and less to the plan than those brand name medications. So another, like I was saying earlier, it's always great to have an open communication with your doctor about if a generic will work for you, or if by chance you are right now taking a brand medication, if it loses its patent and a generic becomes available, can that work for you? So it's always a good thing to keep checking on. Next slide. Prior authorization. So I touched on this as well. So prior authorization, so this monitors prescription medications to make sure that you're getting the prescription that is suitable for the intended use and covered by your plan. So if your pharmacist tells you that a prescription needs a prior authorization, it simply means, again, that we need more information from your doctor just to make sure that it is that the plan basically covers your medication. So only your physician can provide that to us so that we can complete that review for you. Next slide. Drug quantity management. So this program verifies that the correct quantity, either tablets or capsules, of a medication is prescribed. So when you're prescribed certain medications that are part of this program, Express is going to make sure that you receive the amount or the quantity that's considered safe and effective by the U.S. Food and Drug Administration. And it's also going to make sure you get the most cost-effective product strength that's dispensed. So for example, let's say that a member is prescribed a 100 milligram strength of a medication with a therapy of 2 tablets per day. So this program is going to kick in this example, and it's going to require that conversation with the doctor asking, why can't that patient get a 200 milligram strength at just 1 tablet per day? And so that is just kind of an example of how this can come into play for a member. Next slide. All right, to be a smarter pharmacy consumer first, I kind of hammered this home, haven't I? So I always ask your doctor for a generic or a lower cost equivalent. So I've touched on that quite a bit. So enough said about that one, right? Always making sure that you're getting that lowest cost option. It's great for you. It's great for the plan. I always use the most cost-effective pharmacy channel. So what's great about your benefit through the state is you have a lot of options. So I do encourage you, be a smart consumer and shop around, because you have a co-insurance benefit where there is no flat copay involved there, as well as you have the option of filling your medications at retail or through mail order for up to that 90-day supply. So really encourage you to take advantage of our digital tools and our price and medication function within those tools to see where to fill your medication at the best price. So definitely take the time to do that. Always take your medication as prescribed. This is important to always have that line of communication with your doctor, just to be sure that the correct directions are on your prescription, because that dictates how it's being dispensed and how often it can be dispensed. And so it's always good to double check that and make sure that you're taking it as prescribed. Don't be fooled by coupons. Hundreds of high-priced brand medications offer coupons, but please do beware. So a temporary discount to a patient can put it down the path to higher copays and premiums, because it's really, it could lead to higher premiums underneath your benefit by going outside and taking that temporary discount through a coupon. Lastly, daily routines often impact how you're taking your medication. There would be holidays, vacations, or just general life events. So we do encourage you to use your smartphone or a daily planner. There's also dose reminders on the mobile app, just to make sure you're not missing a dose of your needed medication while all these life happenings come into play. A few more slides here. We'll go into resources. I'm going to click 2 down. Thank you. So resources available to you all. So of course, member services, the phone number on the back of your ID card. They're there for you 24/7, and they are there to answer any general questions that you have about your benefits, or they can get you in touch with a specially trained pharmacist if you have any questions about your medication, how to take it as prescribed, or any concerns that you may have. So that's the first one there for you. Next slide. The mobile app. So this is one of our 2 digital tools here that helps you manage your benefit on your own time. It's compatible with most mobile devices. You would simply search for it in your mobile device's app store by just searching Express Scripts. And then as you create a username and password, you would use that same username and password on expressscripts.com. A lot of great functions here to price the medication, check coverage of medication, look into home delivery, and so on. And the last one I want to touch on here, the next slide, is expressscripts.com. A lot of the same functions as a mobile app, of course. This is a great one-stop experience for you. By logging on, again, you can look into your order status of your medication, tracking details, automatic refills, see what pharmacies are in your network, and so on. So then that will round me up here, and we can open to any questions that there may be.
Thank you very much, Amy. That was very insightful, and I'm sure it was helpful to many. It's been very quiet in the chat. So if anyone would like to throw in a question, please feel free. Or if you have a question directly for Amy, you can raise your hand or unmute yourself and go ahead and feel free to ask now.
I think they have the ability to send me a private chat as well, possibly. And if they're able to do that, they can certainly do that. If it's a more personal question, and I can follow up after the call here as well.
Okay. I'm not sure if they can, but we'll see if they can. If not, then if you do have a question that's more on the personal level, please feel free to reach out to the benefits team or myself, and we can always make sure that Express Scripts get the questions that you send us.
Great.
Yeah, and I was just going to reiterate too as well, Clark, is that if there's any questions after this session, please feel free to send them over to Amy and I. They're more than welcome, I'm sure, to contact you, and then you can forward them over to us and we'll respond.
All right. So, well, here we go. Here's a question. Is there a cost advantage to using Express Scripts versus the pharmacy? I'm assuming maybe the mail order service versus pharmacy.
Mm-hmm. And, you know, there very well could be. That's where it comes into the slide I talked about, just shopping around, because with your benefit, you have a lot of options, as well as with a co-insurance for your medications. If there is a price change in the market, you may experience that price flux as well in your co-insurance amount. So there will could be a cost advantage in going to Express Scripts home delivery. May not 100% always be the case. So I would encourage you to always use the price of medication tool to just double check prices between home and delivery and your local pharmacy.
All right. All right. Well, I think we've officially, well, we're about 50 seconds early, but we've officially reached 12:30. So thank you to everyone that attended. Thank you very much, Amy and Pat, for dropping by. And I hope everyone has a good day.
Yes, thank you, Clark, for allowing us to talk and speak with you all today.
Thank you all.